Assalamu alaikum. We will talk about the 5 moments of doing the hand hygiene. So there's 5 moments to do the hand hygiene, starting with before touching the patient. Why you're doing hand hygiene before touching the patient? We will have a situation like you're entering the patient room, you want to handshake the patient. So before touching the patient, you should perform hand hygiene. Why? Because maybe there is a germ in your hand because you was outside the patient room, you maybe visit another patient and you didn't clean well your hand, so you have germ in your hand. If you shake hand with a patient, he will have the germs also. The second one, it's before cleaning or aseptic procedure. We will say you will do catheter suctioning, catheter insertion, or secretion aspiration. So before you do that thing, you will perform hand hygiene. Why? Maybe there is germs in your hand. When you do catheter insertion, the germs will come with the catheter inside the patient. Or if you do a secretion of aspiration, so you will put the line inside the patient tracheostomy, so he will have the germs inside. Because that, you should do the hand hygiene before any clean or aseptic procedure. Third one, it's after fluid exposure. So this is come under, maybe you will do a dental care for the patient, so you should do the hand hygiene. Maybe the germs in your hand, it will come to the patient mouth, or if you will do dressing to the patient and you will clean the area, you should do a hand hygiene. Maybe it will come to the patient wound and it will affect him. Fourth thing, after touching the patient. Why you're doing after touching the patient? We will see, take scenario. Maybe you help the patient to move around the room. There is germs in your hand. So if you didn't clean your hand after assessing the patient, you will carry it in your hand to the other patient or to the other staff you will shake hand with. So we should perform hand hygiene. Fifth one, after touching a patient's surround. So maybe when you are in the patient room, you are talking with the patient, you change his bed linen, or you touch the table and you touch the thing around in the table. So if your hand is contaminated with the patient germs, you shouldn't take it outside the room. You should perform a hand hygiene after touching these things. So this is the 5 moments of hand hygiene: before touching the patient, before clean or aseptic procedure, after body fluid exposure, after touching a patient, and after touching patient surrounding. Thank you.